We have us Dr. Justin Bird. Welcome.
Thank you.
Tell us about your work here. How long have you been here at GFK?
Well, I arrived in September 2009 through HEARTT organization as a volunteer, and started basically taking care of all the trauma patients in the emergency room that come in with injuries to their muscles, bones, and I've been doing that since September, and then trying to organize the orthopedic program, outpatient clinics, and elective surgeries that we see come through JFK.
Trying to organize an orthopedic program, what do you mean?
Well, there's a lot of things that go into developing a program for orthopedics. Orthopedics is the treatment of musculoskeletal injuries, and a lot of it can be related to the trauma that we see from motorbike accidents and car accidents. But there's other things that orthopedic surgery deals with, taking care of deformities, so children that have maybe club foot or dislocated hips when they're born, things like that. So we're trying to put together a program that can enable us to take care of those conditions that we see, both traumatic and conditions that patients are born with, in addition to infections. Train the local staff, nurses, physician assistants, medical students, and other consultants, how to take care of these patients.
And how far are you in setting up this program here?
Well, it's always a work in progress. We've done a lot in terms of the emergency care and how patients are treated when they come in, initially, how they're managed. And a lot of those problems, they need to be diagnosed quickly, and then the appropriate treatments given as soon as possible before they get, the problems get worse and there's complications. And so we've made a lot of progress in that. We're still trying to identify people to train. And there has been interest in the medical students. It's good to see the medical students coming through this last year that graduated, and there's interest in orthopedics, and so we're encouraging them and giving them classes and training so that they can address these issues, because some of them will be out in the rural areas and taking care of patients, and they'll be on their own, and so they have to have an understanding of orthopedic problems and how to manage these, so that they can take care of their patients out there. So I think it'll take years for us to get where we want to be, but in a short period of time we made a lot of progress. So we're excited about that.
On the clinical side, are you getting a huge caseload?
Oh yeah, we see a lot of cases. I was looking through the cases that we saw in November, and over 100 cases of just trauma that comes in, and that's a lot for what we have here and the resources that we have. And in the hospital I came from in New York, we would have 20-some surgeons taking care of this type of caseload. So to have there's only a few of us. So it's a lot of work.
Are you effective with the low manpower?
Well, what we had to do was we had to create different ways of managing what we see. So instead of being able, I knew we wouldn't be able to take care of every case the way I would normally take care of it if I was working with all the resources that I wanted. So we had to develop strategies to deal with these problems in a different way. And so what we've come up with protocols in the emergency room to treat it a little bit differently, but effectively in the setting that we're in. And I think that's helped cut down a lot of the complications, a lot of the injuries that we saw. If they're not treated properly, then they go on to amputation, for example. And we've cut down on the number of amputations that we've been doing by the way we've been treating them and coming up with these protocols. So.
You were working in New York, and we understand you volunteering in Liberia. What drove you to want to be a volunteer in Liberia, a post-war country?
Yeah, I think it was number one. I was a member of an organization, Orthopedic Overseas, so I've done work in similar settings in developing countries where the technologies aren't there, the resources and the manpower and the trained personnel. So I think it's very challenging. It's something that I wanted to do to help, because I think in New York and in developed countries, there's a lot of money, there's a lot of technology, and we're doing amazing things, and a lot of advances are being, are being done. But I think if we continue to focus on that, then we leave a lot of people behind, and they don't get the care that, even basic care that they should get. So I wanted to come and help for a significant period of time to get a basic foundation in orthopedics in a developing setting, developing country. And then, so I had this idea. I thought I was going to go back to a country I had worked in southern part of Africa, but then Dr. Shalif encouraged me to come here. He said there was a really a big need, and I thought I could do a lot if I came here, and given the need and how I had been trained and what I knew about orthopedic care and the trauma, and especially the other places I was considering had some orthopedic surgeons, and there was just a very large need here. So I said, I should come and.
Now, are you enjoying the job in Liberia?
Oh yeah, very much. Yeah.